My name's John O'Connor. I'm 65 years old, married, wife Mary. I have 2 children, a son Brendan, daughter Caitlin. I currently work in the construction field, and I underwent what they refer to as an episode or a heart attack. April 1st, I was working on a roof here in town, and the fellow I worked for, I turned to him and said that I wasn't feeling well. I get down off the roof, and my son was working with us that day. And after being down for a couple of minutes, I told him to take me home. By the time the medics got there, I had pressure on my chest and just wasn't feeling comfortable at all.
We got the call. Usually it comes into whatever the caller said was going on. In this case, it came across as a 50-something-year-old male patient having chest pain and shortness of breath. By the time I got to the hospital, I had some basic stuff done for him. Had given him a few medications, and they had that EKG I sent them in their hand. So they already knew you were having a heart attack. It did go very smooth, and you know, the other 2 partners I had, they were fantastic, you know, recognizing that we had to pick up the pace, and everything just went really good, and I'm really glad to see you doing well, John, you know.
We get to St. Mary's in what seems like a pretty remarkable amount of time. I'm immediately wheeled in and into the emergency room, where there's a group of people hovering over me. And it's one of the nurses says, "Mr. O'Connor, you are having a heart attack."
And one of the doctors came in, I can't remember what his name was, and he was on the other side of John, leaned over and looked me right in the face and looked at John and said, "We can fix this. We can fix this quickly." And it was within another less than 5 minutes, they were taking him up to the cath lab.
Dr. Woodman talked to me the whole time he was doing the procedure, said he's going to do an angioplasty. He went in and said I had 100% blockage of the left ventricle, which is what they refer to as the widowmaker. And he said, we're going to be putting a stent in. And once he did that, the pressure in the chest was immediately gone. It was like someone turning a valve, just opening everything up. I was very impressed with the way St. Mary's had handled it, how fast everything had gone, how professional it was, starting with the transportation from Cheshire to there, and from there upstairs, and finally into a recovery room. Everything was just so smooth and seemed to take so little time. And everybody, again, so professional, so helpful.
It's definitely been a life-changing event in everything that we've been doing. And John's done a great job. He's been an inspiration to try and help me get a little more on track myself.
The only thing I said to him is don't do that again. It's the only comment I had for him after, because, I mean, that's something I don't ever want to live through again. I don't want anyone else to ever live through again. It wasn't one of the easiest days of my life.
You always think about it, and what if, and oh, that'll never happen to us. And I used to think John does have heart disease in his family, and there's a little bit of it in mine as well, and you just never think it's going to happen to you. So I'm very grateful that he's here. I love him, and I hope it never happens again.
The work they're doing is why you're still here. The chance to meet Mark, the EMT, was nice. That was rewarding. It's again, because he was an integral part in the whole process. So if there was anything that I could do, that's what I would like to, is to meet all the people that were there and to thank them. Because it's something they do every day, and I'm sure they don't get the thanks they deserve for what they do. It's like most of us. You go to work, you do your job, you go home. So I would have really liked to have thanked all them personally.